Well, welcome everybody to this evening's Research Australia Health and Medical Research Awards for 2018. I'm sorry I can't be with you. I'm on my walk around the electorate for autism, but I know this room. It's a galaxy. I think that's the right collective noun for our amazing researchers and scientists and those associated with advancing medical science and treatment who are in the room for the awards tonight. Firstly, I thank you, and secondly, I honour you. But to give you a pathway forwards, as you know, medical research is one of the 4 pillars of our long-term National Health Plan. We have the National Health and Medical Research Council, the Biomedical Translation Fund, the $500 million which is going into translation. Half of that is government equity, half of that is private sector capital. But in particular, I want to talk about the Medical Research Future Fund and the 4 great themes that we're working on off the back of your advice and suggestions. Firstly, supporting patients. The $250 million Rare Cancers, Rare Diseases Clinical Trials Program is not just open, but the first $36 million has been allocated. There's another $33 million round, the 3rd round under that program, which is currently being assessed. And these trials are literally about saving lives, whether it's in terms of cancers or enzyme deficiencies or genetic conditions, cutting-edge trials where otherwise patients may not have been able to have had that access. Secondly, we're soon to open under the researchers component the Frontier Science, and the Frontier Science initiative will see another $250 million allocated through a 2-stage process. Exciting, new, researcher-driven, innovative, collaborative programs for breakthrough science within the health and medical research sector. And as well as that, we have our clinical fellowships. So 2 stages for Frontier Science and the clinical fellowships, where we've got nearly $80 million that's been allocated to the forward support for our brilliant young researchers. Thirdly, we have our translation programs, and this includes $125 million for chronic disease translation, particular focus on diabetes and cardiac, but not confined to them. There's, as part of that, now $85 million for the translation centres, and each of these translation centres around the country is doing incredible work. And then another 45 for the Biotech Horizons program to literally transform, whether it's drugs, devices, systems change through innovation. And then finally we have our missions, and you have really driven our missions. The brain cancer mission, a 10-year mission where our initial $55 million has been doubled through to philanthropic funding, so to make it a $110 million plus mission with more announcements to come soon. The work of the Million Minds mental health mission, over 10 years to help 1 million Australians access better mental health treatment and cutting-edge research that can be applied to their practical daily lived experience. And thirdly, we have the genomics mission. This is a $500 million mission, a decade-long investment, as you know, to transform diagnosis, treatment, recovery, to transform the workforce and to ensure that we have the critical infrastructure to back the genomics revolution and the precision medicine revolution in Australia. These are exciting days, and I want to thank you, I want to honour you, I want to acknowledge you, I want to congratulate everybody that has been nominated tonight, and particularly to those who are successful. What an achievement. Have a great evening.